Unlock your ankle flexibility and decrease shin splints with foam rolling through your shin. Okay, so John is getting onto the muscle portion of the front of his shin. Okay, so it's not directly right in the center, then you're on your tibia. He's moving just over to the side. You see how he is kind of in a tabletop kind of position, and he places his shin on top of the foam roller, but he's kind of angled to the side in order to get the outer edge of the muscle of the anterior tib. And he might even get to a little bit of the peroneals, the outer muscles of the shin. And he's just rolling back and forth. Once he gets to the lower half of his shin, he's going to be kind of a little bit more on bone, so he doesn't have to really go to that part. He's just going to stay up to like just below the knee until about like mid shin or so. This is really helpful to do in addition to foam rolling your calf in order to address shin splints, because the muscles that contribute to shin splints are in the back, like in the calf, some of those deep muscles, as well as the muscles in the front of the shin. John's going to scan through this area for 1 minute. Then after that, he's going to hold whatever area feels more uncomfortable, and he's going to hold there for 15 to 30 seconds. Can you do that? He cannot.